Okay, good morning, everybody. My name is Alma. I am a master's student in environmental science. And this morning, I'm going to be talking to you about the partnership that we have with Cochise Health and Social Services. They are the county agency in Cochise County that promotes environmental protection and environmental health, public health for its residents. Also, we partnered up with Naco Elementary School, the only school in Naco, and our efforts this past year, 2019, in building a risk assessment for Naco Elementary School students. So to give a little bit of background and context as to why this work is important, there have been sanitary sewer overflows, SSOs, in ambos Nacos, which encompasses Naco Sonora and Naco Arizona since the mid-1980s. These usually happen during times of heavy rain when the water infrastructure is compromised, it's overburdened, and because Naco Arizona sits at a lower elevation than Naco Sonora, these SSOs tend to go northward. The effluents go through residential areas, including by the school, and through non-residential areas, so more like open areas. The SSOs are not uncommon along the border. They're not just happening in ambos Nacos. In fact, the US-Mexico Border 2020 Health Promotion Initiative identifies the lack of access to sewage as one of the causes for infectious disease, including gastrointestinal disease. So Naco Arizona is a small unincorporated community of about 1,000 residents. So it's very small, it's east of Nogales. So even when you look at Google Maps at this scale, it doesn't even show up. I had to go ahead and label it myself. I don't know how to use is it this green one? But does it have a, yeah, pointer? No. Okay, well, I'm gonna right here. And I had to go ahead and label it myself because, like I said, it's so small that at this scale, it doesn't even show up in the map. And in 2018, it experienced a series of SSOs throughout the year, the worst one being around September, where it was receiving up to 250,000 gallons at the entry by the school, and up to 430,000 gallons on the more open area on the west side. So this led CHSS to declare a state of emergency. Also because it was not very content with the response it was receiving from state and federal agencies. So in order to get that extra financial support and attention, it declared a state of emergency. And the director of CHSS, Carrie Langley, reached out to several people here at the U of A looking for partnerships on how to study this area and to look at the potential impacts of the SSOs. So we began to talk to them around the time of the CLIMAS our initial presentation back in October 2018. And then continuing these conversations, we decided that the SSO that was by the school was of more urgent need because it had the greater risk of exposure to the students. So then naturally we had to go ahead and reach out to the Naco Elementary School, the environmental health specialist from CHSS, along with myself, Dr. Gerba, who is also one of my advisors, and an undergraduate student in my lab, Diego Huerta. We all drove down there, met up with CHSS environmental health specialist, and met with the Naco Elementary School principal. And when we met, he walked us around the school and walked us to this open area where he was envisioning having a school garden. He wanted for each grade to have their plot of land, grow vegetables, and to use that produce in the school cafeteria and give it to other families in need, whatever was surplus. And then he walked us to the south side of the school by the track, and he was telling us that he wanted to build like a nature pathway and a kiosk for teachers to come out and do like outside reading time with the students. However, all efforts were halted because the community and the school board was concerned of contamination that could have built up from these SSOs. Because like I said, the SSOs were really, one of the effluents was very close to the school. This is the fence from the school, like on the southern side. This is the port of entry. And one of the effluents was coming like right around here, like and by this wash. So as you can see, it was very close. It was only about 200 feet from the school. So then our interest just like lined up really nicely. So then we expanded our partnership to include the Naco Elementary School along with CHSS and us here at the U of A. So in order to be able to work together, we had to build trust with the school, not just with the principal. So we attended the school board meeting where there were parents and teachers present, and the school board was present as well. We explained to them what our objective was, what we wanted to do, and they were able to ask us questions, and we got their signed approval. And then we, oops, no. Oh, there. Wait a minute. There it goes. Okay. Oh, thank you. Okay. And we also participated during their summer school. This is a Facebook post from one of their teachers. We went out to related environmental quality with environmental health. So we took water samples from around the school and analyzed them from, it was like a store-bought water quality testing kit. So I think this was a success because one of the boys from the group, he came up to me after and he wanted to know where we had bought the water quality testing kits because he wanted to do some tests in his own household. So I thought that was really cool to get them starting to think about that, especially because one of the main concerns from the director of Cochise Health and Social Services was that there was a public sense of a very casual attitude towards these SSOs because they had been occurring for so long. So public or risk perception was like a huge concern of hers. One incident that she told me about was during September, during this time of heavy sewage overflows. They had water had pooled by the school track, and it took her prompting the school coach for them to cancel the track meet for that day so that students wouldn't be directly exposed to the pooled water. So changing that perception was very important, which was part of the reason why we wanted to also work with students to get them to think about this as well. So we had to refocus our objectives so that we included a risk assessment specifically to the students. Another one of our goals was to co-implement a water and soil sampling plan along with the county, and to produce informational material at the end to give back to the communities and the families for them to take back home and be more aware, create a larger sense of awareness around SSOs. So to approach this, we used the quantitative microbial risk assessment, which is a framework that is used by many water regulatory agencies to look at their wastewater pollution problem. It consists of 4 different parts. The first one, identifying what is your hazard of interest. So this could be either chemical or microbial. Doing an exposure assessment. So identifying what are the different routes where you can be exposed, and then finding the concentration of this contaminant in the environment. Looking at the dose response. So this has been done for many microbial pathogens, especially where studies from way in the past where it was okay to give participants known amounts of a virus and looking at their response. So then they extrapolated models to see, okay, what would be the risk of getting infected by giving this quantity of those. So for the final step was risk characterization, where you basically get all your variables from 1 through 3, and you use it to quantify your risk of infection. So how could we use that framework and incorporate the local knowledge and expertise of all of our parties that were involved? So for the hazard ID, we chose rotavirus because it is it's very prevalent among children. It causes acute gastrointestinal disease, vomiting. It is very stable in the environment, and it can be resistant to disinfection efforts. Our exposure assessment, this was something that we thought we could incorporate all of the parties involved, so CHSS along with the school. we chose to do a very simple exposure route. So if students were to play in contaminated soil or by the wastewater, and then they go ahead and bring their hands to their mouth, they can get infected. It's rotavirus, it has that fecal to oral route of exposure. And then the dose response assessment, that is already very well established through the literature. So we already have the model that we would use to model the risk of infection. And then the risk characterization would be using, like I said, all those other variables. So today I'm just going to focus on the exposure assessment, since that is the part where we do the most collaborative work. So to do environmental monitoring, we, the first time we went out there, we went out with the county's environmental health specialist, and we picked the samples where we wanted to take samples from. This is the school. And as you can see, this were the areas where wastewater had pooled, and it was also running through a wash here. So under the road there was a wash, so it went underneath, and then there was an instance, like I said, where it was able to reach the track. So we wanted to take samples from this. This is the area where the school garden was proposed, and this is the area where the nature pathway was proposed as well. So we wanted to make sure there was no contamination there. The environmental health specialist went with us back in February. We took superficial soil samples. This is a picture of the wash and then the school, so you can see like it's very, very close. However, all of these times where we took samples, they were not during or after a heavy rain, and they were not after SSO. So we were really hoping to be able to take some samples during an SSO event or after a heavy rain. But because we are 2 hours away from Naco, we wanted to give the county the tools to be able to take samples if one of those events did occur or after a heavy rain. So we put together this kit where all the items that they needed, an instruction manual on describing how to take samples, properly store them, and then run some field tests. So using this Aquagenic, which is like a coli alert, so it does presence and absence of total coliforms and E. coli. And this was to hopefully get samples, like I said, during or after SSOs or after a heavy rain. We also did surveys with parents and teachers. And this is one instance, it was a back to school night. Diego, the undergrad in my lab, and another grad student went down with me and to Naco. And we brought some activities that were given to us by the WRRC's Wet Education Center. And while they were working with students, I was working with parents and helping them answer the surveys. And these were available in both English and Spanish, on paper version or through the iPad. And then for the surveys to the teachers, these were online. And the questions here included like how much time do the students spend outside? What areas of the school do they gather? What do you observe in terms of their hand-to-mouth behavior or object-to-mouth behavior? So all of this will be used to inform the risk assessment. So with everything, there comes successes and challenges and lots of lessons learned. And what I learned is 1 year is really not a very long time to build relationships and to manage varying internal priorities, internal changes, to work together to do a project. I mean, of course it's doable, but we have not finished. We hope to finish and conclude our project by May. Like I said, there's also unexpected changes. So there was the school principal who was like our biggest champion. He was released from his position and another principal came in during the summer. But because we had built those relationships within the school secretary helped us schedule a meeting right away, and we were able to get the support of the new principal. So that was really nice. Our qPCR instrument at the West Center, it was out of order, and we could not get the grant money to buy a new one, but we finally got a new one in November. So we are now starting lab analysis, which is very exciting. CHSS was unable to collect any samples, and it was because their refrigerator where they were going to store it could not reach the temperature required, and this was not communicated to us until after the summer monsoon rains. So that was disappointing. I have inquired about winter rain samples with no response. So I will hopefully be able to catch some of the last winter rains and take some samples. And then ADQ OBEP, so that is the Office of Border Environmental Protection, has done such a good job in working with their Sonoran counterparts during 2018-19 that they have been able to work in their infrastructure, and there have been no more SSOs, which is really great, but unfortunate for us because we have not been able to take any samples during those events. And another great success, I think, is that teachers have expressed their desire to continue this partnership with the U of A. And I think that's because so many resources and attention goes to larger border cities like Nogales that these smaller rural towns get overlooked. So they were like, yes, come work with us at the Douglas Elementary School and let's work in this. So I hope that my lab is able to continue this working relationship in the future, because I think there is a lot of potential there. So yes, my final steps to conclude the project would be to complete the risk characterization. So that includes survey analysis, the lab analysis, produce those educational materials, and report back these results to the Naco school community. CHSS would like to hold on to those results at the moment. We would like to share them with the community first, and I completely agree with that. And I just want to say thank you to Diego, who has been a great help in helping me sample, to CHSS for their support, the Naco Elementary School, CLIMAS, Dr. Gerva's lab at the West Center, and my own lab, Dr. Ramirez lab. That's it. Thank you. Yes.
I think it's going to rain down there on Monday or Tuesday.
I saw this morning, and I have everything ready to go. So yes, I've been looking. Thank you.
Do you have? Go ahead. Oh, actually, that was just sort of jumping off for sort of the logistics and your ability to be flexible to sort of respond to like, oh, it is going to rain or it is raining. Do you have the ability to just, jump in your car and?
No, not during the semester, especially when I was TAing, because I had to do my job, which is part of the reason why we were trained the county agency to hopefully have them, because they were right there to be able to take samples. But because it's only one person for the entire environmental health team, I also understand that they're spread very thin. Yeah.
I was just wondering if you had any preliminary kind of results from some of the water or soil samples that you want to share?
Yeah, I can talk about it very generally because, like I said, the county would like to hold on to the results until the end, but there is no reason to be concerned. In fact, at the moment, in fact, ADQ OBEP came to me or reached out to me at the end of last year because since they had been very successful in improving the infrastructure on the Sonoran side, they wanted to take Naco off their blacklist. So he was asking to see if I could share some of the results to strengthen the case. But CHSS opted to hold on to them, and we would gladly share with them once the project has concluded. Yeah.
So is the sewage, it doesn't have a residual effect in the soil. It's just like, it's nasty when it's wet, but when it dries up, it's fine.
Well, with rotavirus, it has a very high survivability in that soil, and it is resistant to the chlorine tablets, which is what they've been doing. They've been dumping chlorine tablets whenever this happens. So to some pathogens, it might be okay, they might just die off, but to others, it might not, which is what we're assessing here.